Welcome to Know Your Body. I'm Dr. Andrew Wong, alongside our Director of Functional Nutrition at Capital Integrative Health, Araceli Benavides. At our practice, Capital Integrative Health, we take a deep dive into understanding your body and giving you actionable steps to organically give you the healthy life you deserve. And today, Araceli, we are going to be discussing a favorite topic, I think, of yours,
Yes.
small intestinal bacterial overgrowth, otherwise nicknamed SIBO. And that's an issue that causes something that a lot of people know, and they might have gone to GI doctors or other healthcare professionals, something called irritable bowel syndrome.
Yes, a lot of our patients get to us already very frustrated with their symptoms, with their IBS symptoms that they vary a lot. It can be from irregular bowel movements like bloating, gas, abdominal pain. They just don't feel good when they eat. They might have like multiple food sensitivities and they really don't understand why, right? So that's where we come in and we really try to deep dive and really understand like what's the root cause of those symptoms, like what are they getting this. And we actually find a lot of the times we
Disease begin in the gut. And so this kind of syndrome called irritable bowel syndrome is silently, I think, a lot of times affecting a lot of people, even if they don't share it with their neighbor, share it with their friends.
Yes, absolutely. So it seems that it's around like 60 to 70% of patients that have IBS that really do have SIBO that is like contributing to their symptoms. So it's really very important to address the SIBO per se to make sure to get rid of the IBS symptoms for good.
So I want to share a little personal story now.
Yeah, of
So
course.
so I'm a doctor of medicine and board certified in internal medicine. So I just sat for my recertification exam for internal medicine a couple years ago. And one of the questions was on irritable bowel syndrome. And we all know that, in American medicine, which is really, really good at diagnosing and figuring out what is going on from a perspective of labeling, we can label that gut issue as irritable bowel. Oh, that lady has irritable bowel. Oh, that guy has irritable bowel. They must have had a, stressful time and their bowel just is irritable. They're irritable. Their gut is irritable. On this test, it actually said this person has irritable bowel. What is the treatment? What is the proper treatment? And you know what the correct answer was?
What was
I
it?
just, it still blows my mind. It's like 5 years later. The correct answer on the test that I had to do in order to repass that test was reassurance. In other words,
Oh,
doing nothing, just patting them on the back and saying, "Hey, you're okay. Your gut's fine. You're fine. It's all in your head."
yeah. A lot of our patients say that they've been told that everything is in their head and they just need to relax and that's it.
We can't dismiss the gut. The gut is the foundation of health. Having a healthy gut is going to lead to a healthy life. And so, this idea of even I just wanted to say, real quick before we get into deep dive on this, irritable bowel syndrome, just that name alone is like, we don't know what it is. We're just going to slap it with a name called IBS and
Hmm.
pat you on the back. And I think we have to do better than that.
Yeah, a
Yeah.
diagnosis of exclusion. So yes, definitely once we get into like really understanding what's going on and when we do find that there's like SIBO present, basically let's go more into like what it is and how do we detect the SIBO. So basically when we have overgrowth of bacteria on our small intestine, it can be producing three different gases: hydrogen, methane, or hydrogen sulfide. And the hydrogen gas tends to cause most of our patients that have like looser bowel movements, like more towards diarrhea, IBS with like diarrhea. And patients that have too much methane tend to have more towards like constipation. So they might both have like gas, bloating, but one tends to be more related to diarrhea, chronic diarrhea, and the other more towards like chronic constipation. And hydrogen sulfide might vary with the consistency of the bowel movements, but it's very common to have that like sulfury, like gas type of smell, like the rotten egg type of like smell. So those are the three different kinds of SIBO that we can find on breath tests. And basically, to diagnose it, we use breath tests that patients can do at home or at their GI office, GI doctor's office.
So we're talking about gas today. Sounds like we're talking about one of my favorite topics, which is farting. You know I was going to bring that up.
Yep.
So the human body produces 5 to 7 liters of gas per day. So it's normal to have gas, but what's not normal is having a small bacterial overgrowth because we know that the main part of the gut that absorbs and digests food is the small intestine. So in terms of your gut, which starts in your mouth, mouth, esophagus, stomach, small intestine, large intestine, rectum, it's going to be the small intestine that's really where the money is in terms of absorbing your nutrients, absorbing your vitamins, absorbing your food. I think that's why even I like to, I don't know why I'm on a tangent today, but those world series of world champion hot dog contests, they have
Hmm.
these people that do
Yes.
hot dog contests. And Joey Chestnut, this guy that basically can eat 64 hot dogs in a certain amount of time. I can't even eat one hot dog and get nausea. So he's eating like 64 hot dogs, and one of the things that's happening is that he's not absorbing those foods. So he has like some sort of issue with his ileocecal valve, which is between his small intestine, large intestine. That's the theory, so that he can't absorb that food, so his colon is storing hot dogs, so that he can like eat more hot dogs. I just want to say that because it is important that it's normal to have gas, it's normal to fart, it's normal to have gas,
Mhm.
but it's not normal to have bacterial overgrowth because this can cause this diagnosis of irritable bowel syndrome, like you said.
Yes. And so maybe our listeners are wondering, like, why do people get SIBO in the first place, right? Like, why does this happen in our intestines? And one of the main causes is like when the motility in our gut becomes impaired. So if things are not flowing properly in our intestines and food is like the undigested food is staying in our small intestine for too long, then it starts to ferment and bacteria start to overgrow. So why does the motility in our gut become impaired? It might be because the like thyroid is not working properly. It might be because you had some like history of like food poisoning and that impaired the proteins that are responsible for the contraction of the gut. And so think about it as a stagnant swamp. If the water is not flowing, if things are not flowing, just bacteria starts to overgrow there. So really addressing the motility, and we'll talk more about how to like address this and how to treat it, but the motility and not having proper motility is a really common like root cause for SIBO.
And just speaking of this, this kind of reminded me of Roto-Rooter a little bit. That whole the pipeline trying to clean that out. If you're listening to this and you hear some, quote unquote gut sounds in the background, that's actually the construction that's happening the floor down. So thank you to our unnamed construction company for doing that and providing our gut sounds background.
Hope it's not too bad.
Yeah. So then, Araceli, we can talk about also deep dive into what causes small intestinal bacterial overgrowth.
Yeah, so along those lines with the like motility impairment, another common one that everyone a lot of our patients experience is like chronic stress. So even with our body being under stress and but under this like fight or flight mode, also that affects the way that our like gut is like contracting. So the impaired motility and also like the history of recurrent usage of antibiotics. So maybe patients that have had recurrent like UTIs, urinary tract infections, or upper respiratory infections that have had to go on like multiple rounds of like antibiotics that can leads to like an imbalance of the microbiome, like dysbiosis, and that can also contribute to getting small intestinal bacterial overgrowth. And another one that is not too common is when patients have had some sort of like trauma to the abdominal area and either like a surgery, even sometimes it could be C-section, and then there's some like scar tissue, some adhesions that do not allow for like food to flow properly through the intestines, and that can lead to bacterial overgrowth as well.
And then certainly the role of the thyroid is
Yeah.
really, really important. So the thyroid controls metabolism and the speed at which you move things through your digestive tract. So if your thyroid hormone is underperforming, you think that, oh, your thyroid's, performing, and you check it on labs and it's normal, but it may not be optimal for you, and you could actually have a functionally underperforming thyroid, which then leads to gut hypomotility, meaning slow motility, an impairment of the roto-rooter, so to speak, clean out of your system, and then basically that leads to bacterial overgrowth. Really, really
Very important.
common. And I just want to mention that because there was a study that was done in the Journal of Gastroenterology that showed, World Journal of Gastroenterology rather, that showed that the most common association between SIBO and another medical condition was actually hypothyroidism.
Hmm. Yes, we do have a lot of patients with hypothyroidism as well.
Definitely check that out. What about medications? How do medications affect SIBO?
Yeah, like the chronic antibiotics is one of them, and also like the history of steroids that can also
Mm.
affect the motility in the gut. Those are the two most common, and PPIs, which there has been like mixed information about that. When there's like suppression of the stomach acid, that's what like the PPIs do. Like it's typically used for like heartburn or acid reflux. When we're like lowering our stomach acid, there's a chance that we're not killing bacteria that we're swallowing. Like we have a lot of bacteria in our saliva, and when we swallow it should get killed off with the stomach acid. But if the stomach acid is suppressed, that kind of like give them a free pass for those bacteria to get to the small intestine, and that can also in some cases contribute to SIBO as well.
So PPI is proton pump inhibitors, so basically
Mhm.
inhibiting the stomach from making stomach acid,
Correct.
from pumping out that stomach acid that we need to digest protein and other foods. Great. Well, I think we talked about kind of the root causes of most irritable bowel syndrome being small intestinal bacterial overgrowth. So now we're going from a label to actually a deep dive underneath that label, underneath the hood of that label, and we're seeing what causes SIBO, as well, and going deeper into that. When we come back, Araceli and I will discuss ways to treat small intestinal bacterial overgrowth, or SIBO, and irritable bowel syndrome. This is Know Your Body. Welcome back to Know Your Body. I'm Dr. Andrew Wong, alongside our Director of Functional Nutrition, Araceli Benavides. Earlier, we discussed what small intestinal bacterial overgrowth is, and now let's talk about how we at Capital Integrative Health find out about the root causes of IBS, i.e., SIBO, and also what steps we'll take together to address it. But first, we want to actually discuss something from the first segment, which is how do we know if someone is just having some intermittent gas and bloating, or something just acute, or is it something chronic that we can label or talk about as irritable bowel syndrome?
Yes, absolutely. Well, definitely SIBO symptoms tend to happen for longer periods of time. So it's not necessarily like maybe you ate something like one day and then you're experiencing symptoms for like 24 hours afterwards. This tends to happen like consistently. And a lot of our patients, what they say is like, it doesn't matter what food they're eating, they have the symptoms like anyway. So it's just sometimes like hard to track like what's like worsening the symptoms. And they tend to have either too much gas and the smell might be like really strong. They might have like bloating and distension of the abdomen, so not just like regular like gas that anyone can have, but just like really persistent in the to the point that they're like it's embarrassing, like they might not be able to control it, like in like places where they're with other people. And the abdomen tends to be like distended. Sometimes they even refer like I look 5 months pregnant, and like it's just really bad. The bloating, it might be causing some like pain, and there's a component of irregular bowel movements. Sometimes it's just chronic diarrhea, sometimes just chronic constipation, or alternating. The patients might get like constipated for like a day, and then the next 2 days they might have more diarrhea, and then they might be constipated again. And it's just really hard to get like a regular normal like bowel movements, and the consistency might vary as well. So those are common like GI symptoms when it comes to SIBO, but also um, the overgrowth of bacteria in the gut. As we know, the gut health is connected with the rest of our body, so it can lead with like other symptoms like anxiety, mood symptoms, like even it can trigger like skin conditions like eczema or psoriasis or rashes. So like it just can go to like more systemic symptoms as well, or like worsen those symptoms too. So yes, we wanted to make sure we went a little more in depth on like what kind of symptoms they might be. So if you're listening to this and you feel like there's symptoms that correlate with you, it might be a good thing to request to get checked for SIBO through a breath test.
Araceli, I just want to zoom out a little bit more, even than that, in terms of the medical side. Just
Yes.
we know that this podcast is not medical advice. You should see your medical or healthcare practitioner. If you have chronic gut issues, it's probably important just to say, I'll just say this really quickly, is that, there's certain red flag symptoms if you're having sort of, severe abdominal pain, if you're having uncontrolled nausea or vomiting, if you're having involuntary weight loss, if you're having blood in your stool. I mean, these are things that you need to see your healthcare provider about. So not everything is considered SIBO, and certain things are and certain things aren't. And you have to talk to your healthcare provider about that to, differentiate. lactulose breath test,
Yes.
things like that.
Of course, the patients typically what they do is they have to prep for those tests where like there's like 12 hours where they're eating like very low like FODMAPs. And I know we had not talked about what it is yet, but we're gonna get to that. But it's basically restricting a lot of the fibers that these bacteria really like to eat on and ferment. So they do very low FODMAP diet for like 12 hours and then they fast for 12 hours prior to the test. And then they have to drink a solution to stimulate the production of the gas in the gut, which is like typically either lactulose or glucose. And they have to collect like breath samples throughout like different time, like frames of like every 15 minutes to see how much the gas is increasing. And if the gas is increasing before the 90 minutes, then that would be considered small intestinal bacterial overgrowth.
I have a question here, Sally.
Yeah.
So I'm listening to this out, and I'm kind of like, this is really complicated. I don't want to fast for 12 hours. I can't fast for 12 hours. I'm hungry. I don't want to do this special FODMAP diet. Is there a way to treat for SIBO without testing? What are your thoughts about that?
Yeah, well, sometimes we can tell if there's like signs of SIBO through the functional stool test that we do that is like do not require that much like preparation to do it. And there's certain bacteria, like methanobacteria, that is like a methane producing bacteria that can indicate that maybe there's like some methane intestinal methanogen overgrowth that can be leading to like chronic constipation. And then we can just treat it accordingly. Or if patients have a lot of the common symptoms, then we might just treat empirically using some like herbal treatment.
I like testing. I think there's two kind of, different ways to look at it. One is that test, don't guess, basically test, make
Yes.
sure that the way we like to say it, in our clinic is that if you walked into a bar or a restaurant and you were trying to hit the dartboard, it's nice to hit the dartboard without the blindfold on, and that's what
Absolutely.
testing does is it removes the blindfold. The other way though is to say, well, that is true, but no test is perfect. There can be sort of imperfect ways to prepare. Maybe the person's not preparing well or there's costs involved. So the other way to look at it is that the best lab test is your own body,
Mm-hmm.
So if someone is having bloating and diarrhea for a long time and they're bloating more with the FODMAP foods, then we can say, well, likely, that's basically their lab test and we can empirically treat them.
Absolutely. Yes, but as Dr. Wong said, when we do have the option to test, it's always better because it does give us the exact type of gas and like how high it is that can also determine how long the treatment is going to be for and help us determine what kind of treatment we're going to do as well. And as Dr. Wong mentioned, like the FODMAP foods tend to trigger worsening of the symptoms for these patients. So that's one of the questions that we always ask patients. Are you feeling worse when you're eating like cauliflower, like onions, like garlic, beans, like those are common like high FODMAP foods that if you do feel worse with those foods, then it might be that you do have CPAL.
So far, no one has wanted to go into a bar or restaurant with a blindfold on when I ask that question. But in any case, if they are diagnosed with small intestinal bacterial overgrowth, how do we treat that?
Yeah, so there's different options and there's like herbal antimicrobials, there's antibiotics, there's the elemental diet, and we can also use combinations. We can use one first and go to the other, and we treat it differently depending on the kind of gas. So just to give some examples, if we're using like the herbal like route, if a patient has like hydrogen, we tend to choose like two herbs that have like either neem, oregano, or berberine. So those are the three main common ones to treat hydrogen, and we tend to combine at least two. There's also combination products that has like blend of antimicrobials that we might also use it as needed. But if patients are really sensitive or they have like really bad symptoms, we tend to start with like single herbs at a time. And Dr. Juan, I don't know if you wanted to mention something about the antibiotic choices that we tend to do for that.
Yeah, so it depends on, again, like you said, what is going on. Is it a hydrogen dominant SIBO? Is it a methane dominant SIBO in terms of the types of gases that those bacteria primarily produce, whether they're hydrogen or methane? And for methane producing organisms, we'll typically use rifaximin, which is a pretty commonly used antibiotic. A lot of times people use it for actually liver disease, but it's also been used for what's called irritable bowel syndrome, diarrhea predominant, of which SIBO is the most common cause of IBS-D. So rifaximin usually for 2 weeks, and you can repeat that up to two other times. You can get it for as much as 6 weeks. For the methane antibiotics, it's usually a combination of rifaximin and either antibiotic called metronidazole or an antibiotic called neomycin. You'd have to talk to your practitioner about that.
Yes. And when it is methane and we're treating with like herbals, we do tend to include something called allicin, which is basically the antimicrobial component in garlic. So funny enough, the fibers in garlic might trigger worsening of the symptoms in SIBO, but the antimicrobial component that is the allicin can really help to treat the methane SIBO. And we tend to combine it with another herb that can be like oil of oregano. And especially we like to use the emulsified version that is basically like opens up around the like small intestine to make it a little more like targeted. So yeah, that's kind of like a common approach that we use
We're
when
not talking about going to the Italian restaurant to put oregano on the pizza, right? They
no.
make a delicious
So,
pizza around here, so
right.
yeah.
True.
All right. And what about some of the other pieces? So we talked about the herbals and antibiotics. You mentioned elemental diet and maybe getting to some of the other
Yeah,
aspects.
the elemental diet that is the option that will lower the gas like faster because
Mhm.
it's basically just starving off the bacteria. So what it is like a formula that has like very easy to digest nutrients that are going to be mostly absorbed in the stomach and the very early portions of the small intestine. So they're not going to feed the bacteria. The bacteria are basically going to like starve out, but we're going to give you the nutrition through that very like easy to digest formula. And patients do not eat anything else or drink anything else besides like water, maybe some herbal teas, and the elemental diet for like around 14 days. So I would say you definitely need to be like followed by your medical provider, and it's probably the hardest one to do from a patient perspective, but it's the one that lowers the like gas the fastest.
Mhm. Just starve the bugs out. They
Yes.
probably have to be resting or not doing too much, so you don't want to have them run a marathon or something if
Oh
on
yeah,
elemental diet. Yeah.
absolutely. Definitely taking it slow throughout those because with either of the options, like anytime we go through the portion of like killing off the bacteria, there's always a chance to get die off, which is like when the bacteria is dying, like it breaks up and it releases toxins into your system, and that can make you feel more tired, symptoms like nausea. Sometimes the first days might get the like GI symptoms worse, so even worsening of the diarrhea or worsening of the constipation for about the first like week or so until your body like adjusts. And that's why we recommend patients like take it slow and also just drink a lot of water, maybe even some vitamin C to help like neutralize with the toxins. So like die off can be common at the beginning, and we tend to go slowly on the treatment if the patient is or even take pauses on the treatment if patients are experiencing those kind of die off symptoms.
So just gonna play on words on our podcast name, but we do want to know our body,
Yes.
right? If our bodies are sensitive, our bodies are kind of slow to react to different things, we're gonna want to take it easy when we do this type of treatment because there is gonna be some die-off often.
Yes.
People are releasing toxins, they're releasing those, like you said, those bacterial byproducts
Mm-hmm.
from the bacteria.
Yes, and it's like a lot of patients might have tried just to kill off the bacteria and be done. And actually, the SIBO treatment goes like beyond that because we want to make sure that we're like addressing the root cause. So as I mentioned, like the motility in the gas in the gut is very important. So after you finish with like either herbal antimicrobials or antibiotics or like the elemental diet, any option that your practitioner recommended for you, it's recommended to use like prokinetics, which are basically either medications or supplements that are going to help rebalance that motility to make sure you don't get it back. So really stimulating the movement in your gut to have like more regular bowel movements, more regular migrating motor complex, which is basically the way the housekeeping mechanism in our gut, the way that our gut contracts to remove any waste products, any undigested food particles, just keep things flowing, keep things moving.
So just to translate, at least from my simple mind, if you clean out the rotor-rooter, you want to keep that pipe moving because if you clean it out and it's all good, but then the pipe is not moving that well, and that's why you use those pro-connect, those pro-motility agents, the pipe will just get stuck again.
Mm-hmm.
Yeah, that's
Eventually.
why?
Mm-hmm.
Okay. And then we talked about also stomach acid and digestive enzymes. What's the role of maybe replenishing the body's own enzymes to prevent or to treat irritable bowel syndrome?
Yeah, definitely optimizing the way that our body is digesting is going to be key to make sure that we fully get rid of like the symptoms or resolve the IBS kind of symptoms. And really, stomach acid is like such an important piece to like activate enzymes that are going to help break down the protein, and also the acidity is also going to stimulate the production of digestive enzymes in the pancreas. And the more we like produce these digestive enzymes, the better we break down our food and we absorb the nutrients in our gut. So those two are really key areas that we need to like support so the patient is like digesting optimally after or even during the treatment.
I have some more health poems for you. For these, so it sounds like if we have low stomach acid, we're going to have low gut health. We're
Mm-hmm.
going to have low gut motility, and we're going to have low chance of curing or treating SIBO
Mm-hmm.
if the stomach acid remains low.
Yes.
Getting back to stomach acid, I just wanted to mention something because I love to play piano, as you know, I'm a musician, and there's an issue with the digestive orchestra, I like to say. So there's all the different parts of the digestive tract are playing in harmony with each other.
Mm-hmm.
And the conductor of that digestive orchestra is the stomach, and the stomach produces stomach acid, which is almost like the baton of the conductor. So if we have low stomach acid, that means the conductor doesn't raise the baton, and that means the other different players in the orchestra, which are the gallbladder, small intestine, and pancreas, do not play the music of producing those enzymes,
Mm-hmm.
which then leads to bacterial overgrowth.
Yes, that's a great way to put
Yeah, we'll
it.
put some music in here. Yeah.
Yes, and maybe we can mention a few things that we use with patients to help stimulate that stomach acid. That could be diluted apple cider vinegar, but you definitely want to always dilute it and take it before you're gonna eat. Then acetic acid can stimulate the production of stomach acid, and typically the dilution is about like 1 tablespoon in 8 ounces of water. Or maybe using digestive bitters or even betaine HCl supplements. But all of those having to consult with your medical provider to make sure like you wouldn't do that if you have gastritis or if you have heartburn or acid reflux. So
Mhm.
always checking to make sure it's a good thing for you. But that can be helpful strategies to increase stomach acid.
Right. That's right. And then the final thing for treating SIBO, and we just touched this on a previous podcast episode, gut-brain connection, is rebalancing the nervous system. And we talked about how stress creates a digestive mess. And we'll also
Mhm.
discuss stress in the next podcast. So stay tuned for the next one after this. But how does rebalancing the nervous system actually help treat SIBO in the long term?
Yes. So when we're stressed, our body is not prioritizing digestion. Our body's prioritizing our brain or even our extremities if we need to run away. Our heart just kind of like our body thinks that we're like fighting or like flighting is just kind of under stress. So our digestion is not being prioritized. So when we're stressed, we're not producing enough stomach acid. We're not producing enough digestive enzymes. Our motility is low. So everything, like Dr. Wong said, stress creates a digestive mess. So really, while we're treating the SIBO and even afterwards, we really focus and talk to patients about rebalancing the nervous system to make sure this doesn't come back. Because if we do all the treatment, but then the patient is like highly stressed and like chronically stressed, that itself may lead for the SIBO to like come back. So definitely very important. And we use different strategies from like breathing techniques to relaxation techniques. We're doing a whole podcast around like stress, and we already did one on gut brain connection. So definitely if you're interested in learning more about that, go check that episode.
Yes, thank you. And then, do you want to talk about the low FODMAP diet a little bit and how long to do that for?
Yes, absolutely. This is a very helpful diet that we use that really can help patients like manage their symptoms. And we use it alongside when we do like herbal treatment. So that at the same time that we're using those herbs that are going to help kill off the bacteria, we're at the same time preventing feeding those bacteria with these FODMAPs that I like to tell patients that it's kind of like bacteria's favorite food. It's what they like to eat. And so it really makes them produce more gas, and therefore the patient feels worse. So when we're lowering the amount of FODMAPs in the diets, that it's basically fibers present in different kinds of foods, and the list is like very long. So you can find like different resources online, but a lot, as I mentioned before, a lot of like the high ones are like onions, garlic, cauliflower, cashews, like avocado, like different kinds of vegetables and like different fruits as well. So when we like lower, those patients might feel a lot better, but you do not want to do low FODMAP diet for extended periods of time, and especially not longer than 6 months, because it's also restricting a lot of healthy foods. So we just want to use this like in a therapeutic form, helping patients feel better while we treat it, and then reintroducing these foods back into the diet. So very important to make sure that you're not staying. Sometimes I get patients and they're like, I've been on a low FODMAP diet for 9 years. I'm like, oh no, that's not good news. We need to like bring those foods back because they're important for other things. So okay to use only while treating and for shorter periods of time.
And we know that if we are on a low FODMAP diet for too long, or rather any kind of restrictive diet, that might actually change the microbiome and be detrimental to the microbiome.
Absolutely.
So we definitely have to say, moderation is the star here when we're treating SIBO. So thank you, Araceli. When we come back, we are going to have some thoughts on why SIBO keeps on coming back, why you might be frustrated even if you're doing all these gut treatments, you're getting to the root cause, but you're still having gut issues, and what we're going to do about it so that you can finally get rid of all your gut issues. This is Know Your Body. Welcome back to Know Your Body. I'm Dr. Andrew Wong. Let's end this episode on why SIBO sometimes returns even after treatment. So, Araceli, you're treating a patient, they come in with chronic gut issues, and you have them on this treatment. Why does SIBO sometimes come back for people?
Yes, especially for patients that have had a history of food poisoning, I always recommend to check for possible autoimmunity in the gut that can cause SIBO. And there's a particular like blood test that can look at antibodies. So like if you're having an immune response that it's attacking the proteins that are responsible for contracting and just kind of keeping the gut motility going, that's gonna make you have like SIBO again. Because even after you treat it, then the motility is not gonna work properly and then it comes again. So if it's like there's an autoimmunity component to it, we treat it like slightly different. We might add certain like immune balancing components to it. So yes, if you do have recurrent SIBO, we recommend to check for autoimmunity.
Got it.
And yeah, so the motility, as I mentioned, was like super important. And we also touched on the last segment about stomach acid and digestive enzymes. So just optimizing digestion overall to make sure that that's not like contributing. Um, and we also mentioned before this the nervous system, and that's such a huge piece that a lot of patients don't tend to like focus on or like spend time addressing it. So it can be like a program around like hypnotherapy or just kind of like focusing on like managing the stress, and that itself can be really helpful to make sure it doesn't come back.
Great. Thank you so much, Araceli, and thank you all for listening. Thank you for joining us on Know Your Body. I'll be back next week and every week to talk about your health with Araceli and how we can talk about how you can achieve the body, mind, and spirit that you want. If you want to learn more about Capital Integrative Health, check out our website at cihealth.org. Thanks so much for listening.